Because healthcare is such a large chunk of the state's budget, my office is going to begin a study on the effects of this spending on Texas finances. Now, report is going to capture the total cost of healthcare and then provide detail on the sources of healthcare funding and then also look at spending patterns across the state. The report will be released next fall, but here's what I can tell you today. Now, right now, if you look at that pie chart, Medicaid spending is 27.2%. That's over a quarter of the state budget. By contrast, transportation, which we talk about a lot, is only 7.6%. Public safety, which we talk about a lot, is only 5.7%. And this Medicaid provides coverage for about 2.9 million people in Texas, which include about 2 million kids. All of the federal proposals being talked about would dramatically increase the Medicaid program, which of course does mean there are additional state costs. And the Health and Human Services Commission has taken a look at the numbers. They say that the latest plan would add more than 2.5 million people to the Medicaid rolls, which would mean a net increase of $20.4 billion over a 10-year period. And there would be a mandated coverage of about 11.2 billion plus another able-bodied adults, another 9.8 over 10 years. Now, we cannot estimate today the percentage of the state budget that this would grow to from 27.2 to some other number, but we know it's going to be up. Now, in government budgeting, you have two choices. You can raise revenue, which is always, that's a long word for taxes, or you can cut expenditures, or you can do both.